By now, I think it's safe to say that technology has touched all of our lives in at least some small way. Whether we use email, smartphones, video conferencing, or Skype our friends from around the globe, the quality of information that we receive is better and we get it more quickly. In no area is this more evident or beneficial than in the field of telemedicine. And here to catch us up to speed is Lauren Faison. How are you?
I'm doing great. How are you?
Good, thanks. So tell me, what exactly is telemedicine?
Telemedicine is using the technologies you were just talking about that we use to talk to grandma and we use to talk to our friends to allow patients and physicians to connect across the globe.
I was first introduced to telemedicine during the Haiti earthquake response. We were able to take our physicians here in the States and connect them with medical responders overseas. We are now using the same kind of technology here at TMH to reach out to rural communities and patients who otherwise would not have the kind of care they deserve.
All right, so what kind of practices are you able to incorporate here at TMH to better advance this care?
Well, at TMH, we're somewhat of an urban area, but we have a lot of rural communities that surround us who need our support. We have a lot of patients that come to us from the surrounding communities. And telemedicine allows our physicians, allows our resources to reach out to those communities so they can get care in the communities in which they live.
Telemedicine is great. As a nurse practitioner, it allows me the ability to see people in rural areas that may not have access to medical care. It allows me to assess and treat and follow up on those patients.
All right, so is this beneficial for healthcare staff only, or are the patients benefiting as well?
It's a win-win-win.
Yeah.
Multiple people win from it. The physicians win because they can see their patients from their practices, from the hospital, so that they're not neglecting their duties here. They can still see patients through the technology, and they can actually grow their practice without incurring additional costs. For the patients, it's a win because they get care that they need. Too many, because of transportation difficulties or lack of resources or just the intimidation of coming to Tallahassee, don't get to the care that they need.
Perry, Florida is 50 miles away from Tallahassee. It's a rural agricultural community with some industry. Our patients have to travel a great distance for medical care and treatment, particularly for specialists. So telemedicine has allowed us to give them easier access for psychiatry and other types of specialty services. They don't have to travel, they don't have to take time off from work, and it saves them the price of gas, and it's more convenient for them to do it in a familiar environment.
So as far as hospital stays and the amount of time spent in healthcare facilities, is this able to cut down on that time?
It is, and hopefully it reduces those readmissions or those patients that aren't able to get that follow-up care once they leave the hospital. We can take that follow-up care to them so they don't end up right back in the hospital.
Are you seeing a cost savings for your patients?
Absolutely, absolutely. It's not only for the patients, but it's for, again, our Medicaid, our health care insurance providers, because to pay that physician to log onto the computer and see the patient for an hour is a lot more cost effective than transporting patients either through an ambulance or getting the physician out to where they are.
Yeah, makes sense. So what do you see as the future of telemedicine then?
Really, it's so exciting that we have to focus because the opportunities are really endless. We're looking at bridging therapy services. We're doing telepsychiatry right now because mental health resources are very scarce. Every specialty that patients may need could be done through the technology. We have a lot of peripherals, a lot of other technologies, cameras and high-tech equipment that allows a physician to see everything they would want to see about a patient as if they were sitting right in front of them.
As physicians, through telemedicine, we have the ability to access subspecialists or other consultants that we would not otherwise have the ability to access. This gives us the ability to communicate with consultants from the state, beyond the state, and around the world to affect care in our patients.
If there's a patient watching this segment and they think they might be able to incorporate telemedicine into their care, what's the best approach?
Really, they need to talk to their doctor, to their primary care doctor. If they don't have one, we encourage everybody to find a primary care doctor and say, hey, I might need to access a specialty consult. How can I do this through telemedicine? Right now, we're still building the infrastructure, we're getting the equipment in place, and we're getting physicians to come on board to learn about the technology so they see the benefits for both them and their patients.
All right, great. Well, thank you so much for your time. This is actually a really fascinating area for medicine.
Very exciting. To watch somebody get care that they haven't been able to get through the technology is very rewarding.